So let's talk about your heart. You know, it's a super important organ, and it needs to do its main job, which is pump blood, which is carrying your oxygen to all the organs and cells in your body. But you know what? When you're sleeping, your heart should not be exercising that way. And when you stop breathing, that is the organ that is the most taxed immediately. So think about it. You're breathing and your heart has to pump blood and oxygen. What happens when you stop? It cannot deliver that oxygen to the tissues. The number one side effect, unfortunately, to untreated severe obstructive sleep apnea is a cardiovascular event or stroke. And there are research articles now that are talking about the damage to the heart, even in kids. So for us, it's so important that we fix it while we're young. Like, let's prevent generations of kids from ever having cardiovascular stress. They don't need that while they're sleeping. I have patients where I've looked at their sleep study and their heart rate hit 220. That is the highest one I've caught to date, 220. That's not okay. You're sleeping. You're resting. Your heart needs to be beating in a more parasympathetic nervous system way, not in an overstimulated sympathetic way. So when we're talking about heart stress, if you snore, if your child snores, if your parents snore, they have to be evaluated properly, because we're losing people at very young ages. You know, the next time you find out somebody in their 50s had a heart attack and nobody knows why, you need to wonder if they were snoring and struggling to breathe at night.